Hutchinson-Gilford progeria syndrome is a tragic disease that causes premature aging in its victims, which are young children who do not end up living longer than 16 years on average. The rapid aging results in symptoms that are common in elderly people, which includes wrinkles, joint stiffness, arthritis, chest pains, trouble sleeping, and difficulty breathing. Our study focuses on the sociological aspect of living day to day with the hindrances of joint stiffness to gain a deeper understanding of the lives of those who struggle with progeria. We hypothesized that simulation of joint stiffness would decrease mood and comfort while instilling an increased sense of disability in our ability to maintain self-care as well as usual activities. We chose to simulate the conditions by wearing restrictive bandages on our knees and elbows for a total of 3 consecutive days. Before beginning the experiment, a control was conducted to use for comparison. Each team member spent 1 day recording their level of discomfort in 4 different categories of predetermined evaluation. These included ability to take care of oneself, ability to perform daily tasks, pain or discomfort throughout the day, and general mood. The system of quantification was modeled after the EQ 5D plus questioning, modified slightly to better fit our needs. The categories were then recorded while wearing the bands and were quantified on a scale of 1 to 20. A score of 1 indicates no difficulty in completing daily tasks or self-care, as well as no pain or discomfort, and a good mood. A score of 20 indicates inability to complete daily tasks and perform self-care, debilitating pain or discomfort, and worst possible mood or depression. For each day of wearing the bands, each team member recorded their score using the aforementioned scale. While wearing the bands, we tried to go about our normal daily routines, doing everything we would otherwise do without the bands. Much like how children with progeria and actual arthritis still try to live like healthy children their age. We would wake up and immediately put on the bands, sometimes with assistance. Daily routines usually began with self-care, like brushing teeth, brushing hair, and eating. Most members had little trouble with those tasks and were able to carry them out ordinarily. Throughout the days, most had class for which we continued to attend regularly. Some of us walked while others rode their bikes, which proved to be bothersome on warm days. Prolonged periods of walking or biking resulted in the knee bands slipping down and frustrating the wearers. Other daily tasks, such as talking on the phone, doing laundry, studying, and cleaning, were not necessarily difficult to perform, but could sometimes be uncomfortable or annoying. In fact, nothing done during this experiment proved to be actually painful or completely debilitating at the most. Some tasks were fairly bothersome, especially if done for long periods of time, such as studying or walking. After completing the 3 days of band wearing, we compiled everyone's recordings for the categories of ability to perform normal daily activities, ability to perform self-care, pain or discomfort, and mood, and made 4 individual graphs visually representing our findings. Upon reviewing the graphs, it was clear that each team member had a completely unique experience with the bands. The trends of perceived impairment were not consistent from day to day, as well as from member to member. While nothing was particularly distressing or agonizing, our moods were sometimes less than cheerful. Some members experienced a decreased mood in the beginning of the experiment, which then increased as they got used to the bands, while others had worse moods toward the end of the experiment after they had worn the bands for several days. It is interesting because research of children with progeria shows that they generally have a quite positive attitude and try to make the best of their situation, whereas they will have progeria for the rest of their lives, and we only replicated one of their symptoms for 3 days. A longer experiment might have shown alternate trends in all categories, depicting acclimation to joint stiffness. This would be analogous to how patients with progeria might become accustomed to certain limitations. A chi-square goodness of fit analysis was used to determine if the observed changes in perceived disability represented a significant trend. The chi-square test yielded chi values that corresponded to an insignificant trend. This sociological experiment helped us to gain a better understanding of how a disability affects the overall health of individuals in more ways than just the physical sense. We realized that there are limitations to quantifying disability because everyone perceives things differently, and it is not always possible to make a comparison between 2 individuals.